Hi, my name is Bruno Gobato. I'm speaking directly from Brazil. We're going to present personalized 3D molding technique for treatment proximal humeral fractures and malunion. I have no disclosure for this presentation. Thank you very much, Pascal, Jill, George, Joaquin, for this wonderful opportunity. Our objectives in this presentation is to show how 3D techniques, how 3D planning techniques and 3D printing can be used for non-arthroplasty cases, and how can this be done with no special, no company-related software in a very homemade way, and how to design a patient-specific guide for your own surgeries like fractures or osteotomy. We are not advocating in fixing fracture for all surgeries in favor for arthroplasty, and we know that 3D printing and planning cannot be used for all surgeries, but can be a useful tool. As this is the digitalized shoulder, we're going to present our cases in a more digital way. We hope you enjoy. So this is our first case, a 65-year-old with brain tumor. He had a posterior dislocation fracture. It's a 3-part fracture. So what can we do in this case? We don't have reverse available for this patient, so we could fix or make a old implant like a total or a partial shoulder arthroplasty. In this case, we choose to reduce the fracture in our computer using a CAD software, which we achieved a good reduction. We were not sure if we could fix because of the size of the head, so we planned the locket plate and we see we could have a very good position of the implant. And so for this case, we done the 3D printing because if we choose to do a partial arthroplasty, we thought that 3D printing could help us principally defining the height of the implant, but in this case we just fixed using patient-specific guides. And this is the CT scan after 1 year with matching exactly what we have planned. So we're going to show how we can do patient-specific guides for proximal humeral fracture, and we think with that we can change the paradigm from reducing a fracture and then fix with the implant to fix with the implant and have the fracture automatically reduced. How can this be done? So first of all, we adapt a guide to the proximal part of the fracture, we drill. Then we adapt a guide to the distal part of the fracture, we drill. And the magic is done by adapting the implant to the pre-drilled holes, and we have our fracture or our osteotomy automatically reduced. We're going to show how can this be done. This is a young patient with a 2-part proximal humeral fracture. We have reducing computer, planned the surgery using a locket plate. First we choose a deltoid split. We adapt the guide to the proximal part of the humerus. The fracture is not reduced yet. We mark. Then we adapt a guide to the distal part of the fracture using a fracture pattern as reference. We drill. And now the magic is done. We just adapt the plate to the pre-drilled holes and we just do some maneuvers for the drilling to match the implant. And the fluoroscopy is used only to check if everything is correct. This is another case we planned using a patient-specific guide. In this case, a guide that holds the fracture in location using only K-wires. This is another case that we used augmented reality, HoloLens, and 3D printing, and also used a very simple software called MergeCube. It's a free software to have our planning directly on our OR. Here is a case of a malunion, a patient that had a fracture fixed with a posterior dislocation. What can we do? This is a very young patient, so we mirrored the normal side to the affected side in blue to see the deformity. So we have planned a humeral rotational osteotomy. Here we can see the osteotomy already done. We are not okay with the reduction, so we used 3D printing to plan a fresh allograft to match exactly the deformity of this patient. The advantage of this technique is we have less surgical times and probably less steps during the OR, but we have some steps to do in our computer. We don't have time to show everything now, so we have an extended version of this presentation. You can see on this QR code right on the top of this presentation. You can point your mobile phone and save it for later. Thank you very much. My email is here, my mobile phone is here, my WhatsApp is here. For any doubts, I'm totally open, and this is the link for the extended presentation. Bye bye.